So this is gonna be every minute on the minute, which means that for 1 minute, I'm gonna take you through an exercise. We're actually gonna do the exercise for 40 seconds, and then you'll have 20 seconds to take a break. And then the next minute, we'll do a different exercise. This is gonna be your countdown. I'm gonna show you what to do and give you instructions on how to assure that you're doing it biomechanically correctly so that we don't end up with knee pain or certain types of joint pain. So let's get started. The first one that we're going to do is a wall squat. So you'll wanna set up next to a wall. It's 40 seconds. You wanna go down into the wall squat and hold it. If you start to feel your legs trembling or shaking and you need to stand up and take a break, do that. And then if there's time left on the clock, go back down into the wall squat again. So try and get as much out of the 40 seconds as you can, knowing that there's a 20-second rest right afterwards, okay? So let's get started. So you'll lean with your back up against a wall, and you're going down. Try and keep your low back against the wall. You don't want to arch forward. Keep your back into the wall. Keep your weight in your heels. Try and lift your toes up a little bit. That will make sure you're driving that weight down into your heels. You're just trying to hold it here. You're going to feel some burning. That's okay. Good. And then stand up, and you have 20 seconds before we move on to the next thing, which is going to be a lateral lunge. So you can use a chair for balance if you need to. We're going into a lateral lunge out to the side. This leg stays bent, and you're just gonna stay here and pulse a little bit, okay? You wanna make sure your weight is in your heel. So lift up your toe to make sure that that weight stays loaded in your hip and not in your front of your knee. So keep it back on that heel, stay low, and you're gonna feel it right here in the outside of your hip, okay? So you're stepping out, this leg gets bent. It's kind of like you're sitting in a chair behind you. And I just want you to pulse here, and if pulsing is too hard, just hold it, okay? Now you have 20 seconds to take a break, and then we'll do the other side. So you can chair if you need to. But now we're gonna step out this way, and now the right leg is what's going to bend, okay? Go. So here, I'm back on my heel, lifting my toe up to keep the weight in my heel. My bottom is back like I'm sitting in a chair. You can either hold it here if this is challenging, or start to add a little bit of pulse, like you're doing a mini lunge. Again, we're really staying in, pushing the ground through our heel, not our toes. And that pulse is coming from my knee straightening just a little bit and then bending again. And then you have 20 seconds. Shake your legs out. The next thing is going to be on the floor. Grab a pillow if you want. So for this one, your legs go up. Put your low back down into the floor. You should feel your low back pushing into the floor. And you're trying to straighten one leg for 5 seconds. Bring it back up. And straighten the other leg for 5 seconds. The whole time I'm pulling my belly button in so that my low back is pushing down into the floor. You don't want your back to be arching up, so no tunnels underneath. Keep it rolled into the floor, lower and hold, okay? Now you have 20 seconds to rest. And the next thing that we're going to do is on our stomachs. So this is going to be a plank, but we can modify it to what works for you. So you'll be on the floor. We'll start on your elbows, and you just want to hold, pulling your belly button in. You don't want your butt up in the air, right? So lower, and you're trying to make your back straight as you can, and hold it. If this is easy, you can try to go here, or you can try and go here. If you can do this for 5 or 10 seconds, then come and go here. And then if you can go up again for 5 seconds, do that. We don't want to sag. We want straight as a board. And then 20 seconds to break. And the next one is a reverse lunge. So when it beeps, you're going to step back with one leg, bring that back knee down to the floor. So now, and we're just going to try and pulse here. If you feel unstable, pull a chair in front of you for balance. You're keeping your weight in the heel, not forward, and then you're just lowering that back knee towards the ground. If you feel like you need to, stand up for a second, give your muscles a break, then try and go back down and get more time in. Good. We have 20 seconds to break, and then we're going to do the other leg. You're doing great. So I'm going to get rid of the chair because I don't need it for balance, but you keep it if you need it. So now back with the other leg. My weight is in my heel, and I'm bringing my back knee down towards the ground. If you have trouble, try and lift this front toe up, and that will make sure that your weight stays down into your heel. If you don't do that, you might start to feel some discomfort in the front of your knee. Again, if it becomes too much, stand up, give your muscles a second, and then see if you can go back down and finish it out. Good, and then 20 seconds to break. Then we only have one more, and it's on the floor. On your back again. This is a bridge, so you can lift up, and you're just trying to hold. If this feels too easy, lift your toes up. That's gonna load your hamstrings a little bit more. If that's starting to give you some cramps, put your toes down, and to make it harder, try and march a little bit. So you're just lifting one foot up off the floor for 5 seconds, then lift the other foot up off the floor for 5 seconds. When you do that, you want your pelvis to be straight. You don't want to let it sag. And then that's it. So that's one round through. And then give yourself a 2-minute break, and then see if you can go through a whole nother round of these exercises. Good job.